Have you ever wondered how you could help your patient who's experiencing moderate to severe pain? I'm so pleased to introduce to everyone Dr. Taylor. Thank you so much for being here today with us. She's going to tell us all about a wonder drug that is considered the gold standard for pain control.
Thanks, Merilee. Morphine was developed from opium over 200 years ago as a painkiller. It is considered a wonder drug that has eliminated pain and gave the users feeling of euphoria. The German pharmacist who developed it named it after Morpheus, the Greek god of dreams. Morphine is an opioid analgesic. You will also see it under the name MS-Contin, Oramorph, Cadian, Astromorph, and Duramorph. Morphine is used for moderate to severe pain. It is available in oral, injectable, epidural, and rectal preparations. It can be given in intermediate release form or extended release form for chronic, moderate, and severe pain.
That sounds like an amazing medication, Dr. Taylor. How does morphine work?
I'm so glad you asked, Merilee. Morphine depresses the pain impulse transmission at the spinal cord level by interacting with opioid receptors. The precise mechanism of analgesic action is unknown. However, specific opioid receptors have been identified throughout the brain and spinal cord and are thought to play a role in the analgesic effect of this drug. Before administering a dose of morphine, you should assess your patient's pain level, including its location, intensity, and character. Ask your patient if they experience frequent constipation and provide stimulant laxatives, increased bulk and fluids in their diet if needed. Assessing for decreasing urinary output through I and O ratios may include urinary retention as well as serum sodium level. Documenting their blood pressure, pulse, and a full assessment of their respirations, including depth, rate, and character, is very important. Screening for dizziness, drowsiness, hallucinations, euphoria, loss of consciousness, and pupil reactions before administration is important baseline data to compare to after starting morphine. While there aren't common side effects, there are some that you should be aware of before giving morphine to your patient. Serious, life-threatening, or fatal respiratory depression may occur. Patients taking morphine can also experience seizures, bradycardia, cardiac arrest, tachycardia, shock, and thrombocytopenia. When taking morphine, some patients experience constipation, urinary retention, dizziness, drowsiness, hallucinations, euphoria, loss of consciousness, and allergic reactions such as rash or hives. People taking morphine should avoid driving or dangerous activities until they know how they will respond to the medications. To evaluate the therapeutic response, expect to see a decrease in pain intensity. Oral doses of morphine should peak approximately 60 minutes after dosage. Intramuscular injections should be working approximately 30 minutes after administration. Subcutaneous injections should see improvement within 50 to 90 minutes after administration, and intravenous injections should begin affecting pain within 20 minutes. People who should avoid using morphine include those with a known hypersensitivity, individuals with a history of addiction to opioids or alcohol, those with a recent history of hemorrhage, patients suffering from bronchial asthma, those with a diagnosis of increased intracranial pressure, a history of bowel impaction or paralytic ileus, problems with hypovolemia, shock, or current treatment for depression using MAOI medications. Some important information that you should share with anyone who may be starting morphine includes warnings about abrupt discontinuation, which can lead to serious complications for some individuals. Withdrawal symptoms can occur, including nausea, vomiting, cramps, fever, faintness, and loss of appetite. Respiratory depression can be a serious, sometimes life-threatening side effects of taking morphine. Coughing and deep breathing can be especially important for patients confined to bed. Warn patients to avoid drinking alcohol or taking other CNS depressants, such as benzodiazepine, while taking morphine. Some people have reported blurred vision, dizziness, or drowsiness. Use caution in tasks that require alertness. Patients should report constipation, allergic reactions, and any symptoms of central nervous system changes. Warn patients that morphine exposes them to the risk of opioid addiction, abuse, and misuse, which can lead to overdose and death. You should ask your patient if they are pregnant, plan to become pregnant, or are breastfeeding prior to beginning treatment with morphine. Taking morphine while pregnant can put infants at risk for neonatal opioid withdrawal syndrome. Serious complications can arise for patients under the age of 18, over the age of 65, and those with severe heart, liver, kidney disease who take morphine.
You should discuss possible serious complications with your patient before starting them on morphine. Assess your patient's pain level often. The expected result is a decrease in the number out of 10 that the patient started out at.
Oh, Dr. Taylor, that sounds like some pretty powerful and dangerous medicine.
That's right, Merilee. Morphine is a powerful medication that can be used to treat the most severe pain in patients who are actively dying, but it is also dangerous and can put our patients at risk for addiction and abuse. That's why the FDA has classified it as a Schedule II controlled substance. We use caution in clinical judgment before prescribing and administering morphine, which is why it is so important that nurses and clinicians are well informed of the uses, contraindications, and side effects of this important and powerful medication.